Okay, today I'm going to be doing the newborn assessment. The first thing I would do is wash my hands. And then I would come in and I would check the baby's ID band to make sure I have the correct baby. Shaniqua, female, perfect, right baby. Next thing I'm going to do is take the baby's vital signs. I'm going to start by taking the temperature. I'm going to take this by putting it axillary underneath the baby's arm. And while I'm taking the temperature, I'm just going to rest my arm down on the baby, my hand down on the baby's chest. This helps comfort the baby, and also I can do the respirations at the same time. Normal ranges for temperature is about 97.7 to 99, and respirations are 30 to 60. Baby's temperature, 98.7, respirations 35, perfect. Next thing I'm going to do is listen to the baby's heart rate. Normal heart rate should be 100 to 160. And I would make sure I would listen for a whole minute for the baby's heartbeat to make sure I listen for any abnormalities or any murmurs. Baby's heart rate is 110. Next thing I'm going to do is listen to the baby's breath sounds at the apex above the nipple line on both sides. Baby's breath signs are clear and unlabored. Next thing I'm going to do is listen to the bowel sounds in all 4 quadrants. They're active in all 4 quadrants. The next thing I'm going to do is assess the baby's head. I'm going to assess the head for any bruising, redness, swelling, scabbing. I'm going to check for molding. Molding is a normal sign, which can happen when babies are pushed out of the birth canal. And I don't see any of that. And the next thing I'm going to do is I'm going to assess the fontanelles. The anterior, which is on the top, and it is the bigger one, and it's more diamond shape. And it's flat and soft. And then next I'm going to check is the posterior fontanelle, which is smaller and is more triangular, and is also flat and soft. And then next thing I'm going to do is check the suture lines to make sure they're approximated and sagittal, which they are. And then I'm going to also check for kappa succidium and a cephalhematoma, which are just abnormalities, but the baby has none of those. The baby's head looks great. I'm going to make sure I put the hat back on to keep the baby warm. Next thing I'm going to look at is the baby's eyes to make sure they're symmetrical and even spacing between the nose and the eyes, which they are. Make sure there's no discharge. I'm going to also check the epicanthal folds. If those were abnormal, that would be a sign of Down syndrome, but they're not. The eyes look great. I'm also going to check for subconjunctival hemorrhage, which would be reddening in the eyes, and I don't see any reddening. The baby looks great in the eyes. Next thing I'm going to do is check the ears. Make sure they're midline to the eyes and they're symmetrical and even, and they are. And then I would also check the recoil of the baby's ear just by pulling down this upper portion of the baby's ear and pulling it down. And then I let it go, and it should automatically recoil, which is a sign of maturity. If it didn't recoil and it would just stay there and take its time, that'd be a sign of immaturity. But this baby has great recoil. Next, I'm going to assess the nose for patency. And by this, I'll just cover one nostril and make sure the baby's breathing out of the other, and do that on both sides, which the baby is. It looks great. There's no discharge, no nothing. Baby's nose looks good. Next thing I'm going to do is I'm going to put some gloves on, and then I'm going to assess the baby's mouth. I'm going to just gently put my finger on the baby's lips, and then the baby should open its mouth, and I'm just going to feel the palate on the top to make sure it's soft and there's no gaps or spacing, and it feels great. And then also while I'm doing this, I'm going to check the baby's sucking reflex, and baby has a great sucking reflex, looks good. The lips are no cracking, no redness, also looks great. I'm going to take off my gloves. Next, I'm going to check the baby's neck. I'm just going to take 2 fingers and palpitate the baby's neck and check for any masses or abnormalities. I don't feel anything. The baby's neck looks great. And I'm also going to check for range of motion just by turning the baby's head to each side. Baby has great range of motion in the neck. Also, I'm just going to uncover the baby a little bit, and I'm going to gently palpitate the clavicles to check for any swelling, abnormalities, anything like that, because when the babies come out of the birth canal, they could fracture their clavicles, especially the bigger babies. But the baby's clavicles are great, even, no swelling. The next thing I'm going to do is I'm going to uncover the baby a little bit, and I'm going to assess its skin to check for any bruising, rashes, birthmarks, vernix, lingo, which I don't see any of that. I'm also going to assess for jaundice during this time. The 5 different places you can check for jaundice is you would blanch the forehead. It's great. You'd also look into the eyes. There's no yellowing of the eyes. And then you'd also want to blanch the chest, the abdomen, and the inner thigh. This baby doesn't have any jaundice. The skin looks great. Pink, warm and dry. Brown, warm and dry. Also this time I would check for any respiratory distress. Some signs of that would be nose flaring. The baby doesn't have any nose flaring. A seesaw motion between the chest and the abdomen. I don't see any of that. Any retractions, none of that. You would also look for any tachypnea or apnea, and the baby has none of that. The baby's not in respiratory distress, breathing just fine. Make sure the baby's covered back up to keep them warm so they don't get fussy. The next thing that I would assess is the baby's cord. I would just assess the cord, see if it's unclamped or clamped. It's currently unclamped. Make sure there's no discharge. I check the moisture. The cord is drying up because it's in its healing process, so it looks great. Next thing, I'm going to put on my gloves. And then I'm going to assess the genitals. This baby's female, so I'm going to check her labia and just make sure that there's no discharge or redness or swelling, that it's symmetrical and everything looks great. If I was checking the genitals of a male, I would make sure I palpitate the testes, make sure there's no swelling or redness. I'd also check the meatus and make sure it's where it's supposed to in its right location at the tip. And also, if the baby had a circumcision, I would also check the incisions from that and make sure everything was healing properly. Also, while checking the genitals, I would, if the baby had voided or urinated, I would assess that and make sure it looks normal and then change the diaper, but the baby didn't, so we're good there. I'm going to remove my gloves. Next, I'm going to assess the baby's muscle tone. And by doing this, I would take the baby's arm and I would just bring it up for about 3 seconds and hold it, and then bring it down and let go, and the baby should automatically recoil their arm, which this baby does, so the muscle tone is perfect. And then I would also check the palmar creases on the baby, check the hands. I would look at the palmar creases. This baby has 2. If they were only to have 1, that'd be a sign of Down syndrome, but she has 2. And then I also would assess all 10 digits to make sure they're even and she has all 10 digits, which she does. Next, I'm going to assess the soles of the baby's feet and also check the creases on the feet. Usually on the soles there's a lot of creases, which is a sign of maturity, and if they didn't have any creases, that would be a sign of immaturity. Which she has lots of creases on both of the bottoms of her feet. I would also check and make sure all 10 digits are here and symmetrical and nothing wrong with them. And then I would also check the Babinski reflex. By doing this, I would take my fingertip or just the edge of like a pencil eraser and lightly draw a backwards J up the baby's foot, and the baby's toes should flare up, which they did, and you would do that on both feet, and that is good. Next, I'm going to turn the baby over and I'm going to check her spine. And by this, I'm just going to turn her onto her stomach, but also make sure I hold onto her head. And I just like Check the spine, make sure there's no abnormalities, it's straight, no swelling, redness, bruising. Check for any tufts of hair. And I would also check the hips and make sure they're symmetrical, which they are, even, and everything's great. Then I gently turn her back onto her back. Make sure I dress her back and wrap the blanket back around her to keep her warm. And then I'm also going to check the moral reflex, and by doing this you're just going to slap the bed gently and the baby should react, which she reacted, so she's great. And after that, you're just going to make sure she's all, her clothes are all back on, she's all wrapped up, and either return her to her crib in the nursery or return her to her mother if her mother wanted her.